Just the second week into in-person learning in Toronto, and CityNews has learned that 3 more TDSB schools have been identified as having COVID-19 variants of concern. That brings the total number to 11 schools scattered throughout the city. The kids are still coming and going, likely not aware of anything new. But with the variants of concern spreading in schools, parents may have to think twice.
Do I think that it's worrisome that there is a variant here? Yes. But do I think it's probably in the community and we don't know? Yes, I think it's probably quite likely.
11 Toronto schools are now reporting variant cases, including 3 more within the TDSB since Wednesday. They are Earl Grey Senior Public School, Edgewood Public School, and Pleasant View Middle School. A reflection of what is happening with overall community transmission.
As schools returned to in-person learning, we were expecting that we would see cases within those settings. And in light of the fact that there are variants of concern in the community, we expect and we should expect to see variants of concern within schools. All
students and staff in those cohorts are being asked to stay home and isolate, while Toronto Public Health follows up with close contacts. Toronto schools returned to in-person classes at the start of last week with new screening measures, including staying home if anyone in a household shows signs of just one COVID symptom.
We realize that when you hear about variants in a school, it's concerning, but from Toronto Public Health, we are assured that this was not unexpected and that at this point in time, there are no additional health and safety steps we need to be taking in our schools.
In Ontario, the number of COVID cases in schools since the return to class is at 675. Of those, 564 are students. As a result, 430 schools have a case and 18 have closed. In Toronto, there were 99 schools with cases as of Wednesday, including 34 at Catholic schools and 64 at public schools.
I'm trying to do what I can, following the guidelines and trying to keep safe my children.
The trend in cases among younger age groups has become concerning as well. The proportion of cases among children from 0 to 9 and 10 to 19 years old compared to other age groups has slowly climbed since the beginning of the year.
We are treating every case out of an abundance of caution. Every case that arises within the context of a school will be assumed to be a variant of concern until proven otherwise.
The TDSB says it's too early to tell whether asymptomatic testing is playing into the total case counts. We do know that both school boards are being served by 11 different hubs and 65 schools in total.